when you're looking at a diagnosis of cancer, you have to remember glass half full. One of our medical oncologists always says, we do this to live, not to be. And so I want people to live. I want them to experience hope. And it's hard. It's hard. They're going to have to go through some hard times. But I think that my goal is to always encourage them and to remind them that there is hope, that we know that we're going to grow through this and we're going to come out on the other side a lot stronger than we ever thought we could be. So I am an oncology, urology nurse navigator. Hey, Mr. Woodard, how are you? Good. We have several different nurse navigators, whether it's general oncology, breast cancer, pulmonary, and now urology too, where we can reach out to those people and help them from the beginning until the end of their treatment and the process, and then after that too. I'm there in the beginning. I am there if they have just a general question or concern. I'm there during infusions. I am there during doctor's visits. I'm there if they go to another doctor's office and they call me and say, look, this happened. I can look in the computer and see everything that's going on. So I'm a sounding board. We're here to reassure them they're gonna get through this. In here, there's some additional information, but I also have your prostate cancer book. When you come back in the week after, you'll have some staples. They'll remove them. And then they'll put steri strips in those places, and then he'll come in, look at your belly, and go over the pathology. Okay. So when they start with for a prostatectomy, and that's where it's important too for family to come to these appointments, because we want them to understand, yes, we need to get the prostate out, we need to get the cancer out, but after that, it's a recovery. There's a recovery time, and everybody needs to be patient. That's what I was going to say. They call me like the cancer quarterback. But I can't throw the ball unless somebody calls the plays, right? So he was high risk, but he had some unfavorable too. But yeah, his PSMA is negative. He hasn't seen radiation yet. He's just coming back post-biopsy.
Like I said, anybody that's in the high risk category, regardless of what you have for initial therapy, you're at higher risk of needing additional things just because of the risk category that you're in. But you know, your most aggressive and approach right now is to get it out.
This is my sister, Alice.
Hey, how are you?
I'm sorry I'm late, but we're
Nice to meet you. You're not late. You're fine.
What can I say?
Come all this way. And he said, that's wonderful. Let's just go ahead and enter the orders for surgery.
Good.
Yeah, I know. I'm excited. So I'm gonna talk to you a little bit more about it. With Miss Ritchie, she was wonderful, and I had already established a relationship with her initially with Dr. Willard when she found out that she had the bladder cancer, needed the staging, and she was downstairs with Dr. Willard. Then she transitioned up to Dr. Ryan in medical oncology, and we had to start with that infusion. She will call you with a surgery date.
I can hardly wait.
I hope they are encouraged by me. I hope they know that I believe they can do it. I believe you can look at a situation and know that it's going to be tough, but you're going to get through it. And I think, I don't know any time something great has happened from something easy. That's right. Yes. Go for it, yes. Yay! There you go, that's good. That's right.
It's pretty funny, you'll sit in a room and it's not uncommon to hear them praising the navigators, you know, because they just like having that person on a first name basis that they can call on. I mean, they love my nurses, they love the rest of my team, but just having someone else kind of outside of the immediate giving you drug team, the chemo team, is very helpful. And they love it, and they love those nurses. You know, we hear from patients all the time about what they do for them.
I think whenever we have to go through something hard, we come out the other end learning something and growing. So, you know, hopefully iron sharpens iron, and I have encouraged them and given them the tools to help equip them to get this job done. I love seeing hope, and cancer patients possess that. I think it's more, I just enjoy the human spirit.